My name is Dr. Imran. I'm working as an assistant professor in the Department of Pulmonology in Lady Reading Hospital, Peshawar. This study is basically, I have recently completed my fellowship in the data there and then prepared this presentation. Post-obstructive pneumonitis this is basically a non-infectious etiology inflammation which results from a central airway obstruction which then results in accumulation of the secretions distal to it. It contributes to the mortality in individuals with cancer and endobronchial lesion, and it also results in worrisome morbidity and increased mortality in those patients. Microbiology, on the other hand, in these patients is poorly understood. Like this was thought that this is non-infectious, so most of the time people do not do cultures in these secretions or these collections. Like we can see, this is a proximal airway obstruction, and this is resulting in a pneumonitis here, and a collection of secretions, and like these secretions were then collected after endobronchial tumor resections, and then they were sampled and cultures were done. Same here. This study aims to describe the microbiology of post-obstructive pneumonia in patients with malignant endobronchial lesions. This was the setting, retrospective. This is the time duration, non-probability, convenience, conjunctive sampling, only frequency and percentages. Mean and median were calculated for numerical data. Total cases in these 10 years was 748 of malignant airway obstruction. This is the gender distribution, this is the age distribution. Patients who were diagnosed with obstructive pneumonitis on bronchoscopy, they were 135, and the rest of the data is based on these 135 patients. Among them, patients with positive culture were 51.4% or 61 patients of these. These were the presenting complaints of these patients. Like majority were presented with dyspnea, then fever, cough, and hemoptysis. These were the etiology of the airway lesions after the histopathology. So, majority of the lesions was lung squamous cell carcinoma. As we all know that these are central lesions and they can result in central airway obstruction, which then leads to pneumonitis peripherally. And then esophageal carcinoma followed by lung adenosia and then others. These are the cases without obstructive pneumonitis and these are the cases with obstructive pneumonitis. These were the organisms which were isolated among the 51% of those which were positive culture. Predominantly they were Pseudomonas, followed by Klebsiella. Like predominantly they were gram-negative. Or most of the time, like these patients are subjected to a lot of endobronchial procedures, bronchoscopies and these things. So maybe this was one of the rationale that maybe they have acquired these bugs from the hospital or from the gadgets which we are using for the diagnosis. The weakness of the study, this is like a retrospective and a cross-sectional study. This is novel, like very few studies have looked for the microbiology of this. Like most of the time, physicians or pulmonologists or oncologists, they focus on the malignant component. Like very few of them focus on the infectious component. So if we like timely prescribe antibiotics to these patients, so we can improve their morbidity and it can also like improve their quality of life. So this is the conclusion. These are the references. Thank you very much.
Excuse me, sir. Excuse me, sir. Please.